This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
It certainly is good to be back live in the studio.
It sure is, John.
As we enjoyed this time last week, we were on the beach, Dr. Molly.
It was gorgeous, wasn't it?
It was beautiful. But anyway, we're here, and we're happy to be here. And listen, it's a lot of information that we have for you in the next hour, as we do each and every Sunday. Health Watch, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, as you heard the man say. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. As always on the show, we discuss the who, what, when, where, why, and how of Innovative Medical Associates and how it can potentially help you and anyone you know improve your overall quality of life. We call that our mission statement. And as always, you are welcome to participate in the show if you have a question for Dr. Molly about a particular medical challenge you may have or whatever. 855-839-1210 is the number. 855-839-1210. That's the number here in the studio. And again, Health Watch, Sundays, 8 till 9, Talk Radio 1210, WPHT. A lot going on in Innovative Medical, as always, right?
Well, we just came off the holiday. It was a 4-day week. You know how that is. Got to squeeze everybody in and do what we have to do. And I'm hoping that the people who didn't come in will actually come in this week, and I hope they were enjoying their vacation.
Absolutely, as we were as well. But here's the question, which is the question every week, and the question that you get every consultation. What is it that you do, and how is it different from what you may expect when you go to a primary care facility?
Well, first of all, we are a cooperative of medical providers and healthcare providers who all work out of my medical facility. And actually, what we try to do is anything that can be done with a regular primary care facility. So if you need a pharmaceutical, if you need some radiology, if you need whatever you need in terms of the scope of primary care, we can do. However, philosophically, we're a little different than a lot of other places because what we like to do is really help a patient reduce their need for the pharmaceuticals, thereby reducing their side effects, not just from their condition, but from the pharmaceuticals itself.
We've been ingrained, you and I are about the same age, we've been ingrained since we were kids, that, you go to the doctor, you get a pill.
Well, in the old days.
And you get this pill, and then you get another pill, and then you get another pill, and you're taking a lot of pills for a variety of conditions. And I guess the issue always comes up, even in a consultation with you. All right, but this replaces pills? This helps? Or
it can.
How does this work? Because it's not a pill.
It's definitely not a pill. And let's be honest, there's a lot of things that have been happening in medicine today. 21st century medicine isn't like the old days of your old GP on the corner when we were kids, right, John?
Yes.
Your doc was up the street.
Exactly.
It was a neighbor or whatever.
Exactly. We had two of them, one in each corner.
That's right. That's exactly right. And actually, he would leave his office with a little white envelope of pills.
Yes.
Those days are gone,
yes.
Right? Anyway, but in addition to that, what we like to do is we like to use natural products. So therefore, things that you would normally get in the health food store or in the health and wellness aisle of your pharmacy, those are the products we know and use, natural products. So that can be vitamins, amino acids, it can be minerals, it can be enzymes, it can be a bunch of natural products, herbals. So the question becomes, our delivery system is what's different, John.
Which is the hydration via IV.
That's right.
You were telling me before the show you had a consultation maybe a week or so ago, and the gentleman had been in to see you before, and he said, I decided that I was going to take all this orally.
That's right. That told me I spent too much time with him in the consultation. Right. But anyway, I'm just kidding about that, folks. But anyway, that's right. And now he came back to me and he wanted to do another consultation, which I obliged. And he went from a stage 1 cancer to a stage 3. And it's interesting because I will tell you, John, that I'm not sure we don't cure cancer, but I think he would have been in a lot better shape had he started with me 2 years ago.
So do I, yeah.
So that
I agree.
even if he had an additional outbreak or additional cancer somewhere else, I think he would have sailed through some conventional treatment and still had a quality of life. But, sometimes you just can't tell people that the delivery system of taking it orally, can lose more than 50%.
Well, in the hydration, and
you get 100%.
You get 100%, and it's directly into your bloodstream.
Bioavailable, and that's the key. So that we're able to give a patient a therapeutic level of these nutraceuticals that we know can do the job, but they won't ever do the job if you don't get to that therapeutic level.
So going to the health food store, as we've talked about thousands of times here on the
Yes.
show, going to the health food store is okay, but you should look at that as a supplement.
That's
correct?
exactly what they call it. It's
Right.
a supplement. And do we also tell you what kind of orals you can get? Of course we do. We got the best nurse in the world, Barbara. She'll go through everything and look at what are the products and the brands and the manufacturers that are good quality product, and they can supplement what we're doing in the hydration bag.
Back to the case of the gentleman who said, well, I'm going to take it orally. Obviously, in 2 years, he took it orally, and now he's stage 3 instead of stage 1. So apparently that didn't work.
Yeah.
So it's something you can do, but you can't count on that to do it all, right?
Right. And I'm not saying you can count. One of the things, John, we have to be careful how we say this. You and I both know nutraceuticals can't cure cancer.
Yes.
Whether I deliver them through the hydration or not. However, you have a much better chance if we can get to a therapeutic level of some kind of improvement, whether it's in your stamina, whether it improves your thinking, whatever, to help you make really good decisions and not put your head in the ground. When you have cancer, you got to make some decisions in order to make sure you maintain your quality of life.
How many times have you had patients that have come into you and they've had cancer?
Sure.
And part of your cancer support protocol, you've kind of gotten them into that. And they were supposed to live 6 months, and they're still with you 7 years later.
That's right.
So,
plenty.
So can you address
Sure.
that for a moment?
Sure. I think a lot of that, of course, has to do with also changing your lifestyle. That's very important. And we consult with you on that, changing your lifestyle, changing your mental state and your emotional state, knowing you're doing something to support your quality of life, whatever that looks like. I have a wonderful patient, Vera. She lights up our facility when she comes in. Now, she's got a serious challenge. She has a serious blood dyscrasia. And she's a wonderful woman. She's in her early 80s. And you know what? She does conventional treatment and still comes into us. And you know what her family told me? She looks forward in coming into us. And we've worked out a schedule that really works for her around her chemotherapeutics. That's the key. The key is to utilize these natural products in a way that works, whether you're doing conventional treatment or not, no treatment conventionally. Point is, it can be done, and it can improve your quality of life.
And how many treatments, you were telling me, you've recently kind of put it in packages as far as the treatments are concerned.
Right.
But how many treatments can you expect to get started till you see some kind of result?
Well, you're going to see some kind of result possibly in as little as 5 to 10 weeks, depending on how often you come in. But generally, we put them in let's say, protocols of 10, because we have to get enough in you. Yes, we're reaching the therapeutic value. We give you the therapeutic dosing, but then we've got to get to your reserve. The body is a wonderful thing. It's God's creation. And believe me, God's ingredients work, but we have to do it in an appropriate manner.
We are coming up on our first break of the morning. Our program is called Health Watch, and you'll find us here every Sunday, the live version, 8 until 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PH.D. doctor, the executive director and the founder of Innovative Medical Associates in Marlton, New Jersey. You have a question for Dr. Molly? We're talking about a lot of things so far, and we have plenty more to talk about. If you have a question, a medical challenge, you want to run it by her, now's the time to do it. 855-839-1210. As we always say at this point in the show, it's early. We have plenty of time to talk to you. Don't wait till later on. Should I call? Shouldn't I call? I'll wait till later. And then next thing you know, it's 2 minutes to 9, and we can't take your call. 855-839-1210 with Dr. Molly Fantasia. I'm your host, John DeMasi. We both return. More Health Watch after these words. Hi, it's John DeMasi, host of Health Watch, heard every Sunday morning 8 till 9 and again from 4 till 5 here on Talk Radio 1210. Is chronic pain or fatigue making it difficult for you, or maybe someone you know, to enjoy simple pleasures like walking your dog or spending time with the grandkids? Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates offer medical hydration therapy. Their autoimmune therapy program has helped hundreds of patients to feel better and do more.
We can bring a patient to a better quality of life and then a healthier approach to their entire condition.
Visit innovativemedicalassociates.com to learn more about their autoimmune therapy program. Join me and Dr. Molly Sundays, Health Watch, 8 till 9 and again 4 till 5 here on Talk Radio 1210. As always, when we're on the air, operators standing by at Innovative Medical Associates, and the number is 856-489-0505. Notice I try to say it slow so you can write it down. 856-489-0505. That's the number, Innovative Medical Associates, Marlton, New Jersey. When you call, you want to set up that initial consultation with Dr. Molly, and a lot of people do that. A lot of people do come in and meet Dr. Molly and talk about their particular challenges. You can do the same, 856-489-0505, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And, of course, our show is Health Watch, Sundays 8 till 9, Talk Radio 1210 WPH.D. Dr. Molly Fantasia is here, the PH.D. Doctor, Executive Director, and founder of Innovative Medical Associates. Before we get into what you want to talk about in this segment, I used your skincare, your sunblock the other day.
Good. Yeah.
And I forgot to put it all the way down my arm.
Oh, man.
And I look like wallpaper. I had dark where I had sunburn where I didn't put it.
Right.
And there was no sunburn where I put it.
Yeah, well, that's
So
the object.
that's
man.
the object.
Yeah.
But it really worked very well.
Oh,
So
good. I'm glad to hear that, John. And again, you used the one without the tint.
Right.
The tinted one, I use the tinted one myself. I like it because I don't wear makeup, so it just helps me, get out of bed in the morning and look like I'm alive. So, so thank you, John. We worked hard. Dr. Glass and I worked hard on those products.
Well, I just want to remind folks that we are in summer season, and we were discussing, some of the patients and myself, about your line the other day, and they were purchasing some. So you can go to the website, innovativemedicalassociates.com, and you'll see where the skincare products are, and if you want to purchase some, especially for the summertime. That sun protection, which is, I believe, a 47 you have, which is good.
Yeah, pretty good.
Very good. Okay.
Pretty good.
855-839-1210 is the number, 855-839-1210. You've often talked, Dr. Molly, about chronic inflammation.
Right.
And why is it worth discussing, and why are we going to talk about it today? What's the reason?
Well, I'm going to tell you. Inflammation, I believe, chronic inflammation is the cause of many, many conditions, okay? It can cause things like cardiovascular disease, bone, muscular, skeletal diseases, neurological disorders, metabolic disorders, and, of course, there's a link to cancer. So when you look at this, you have to say chronic inflammation, which means inflammation that doesn't go away after an injury or a trauma. What I always talk about is the Goldilocks theory. This is why it's so important when we talk about inflammation, because let's face the facts. What you want to do is in chronic inflammation, you've really got to cool the fires within. Chronic inflammation, you must do that. But you need that fire when you sustain an injury. For example, chronic inflammation process actually helps if you have a wound. Without the inflammation process, the wound wouldn't shut off. So we really have to look at how God's created this in a way that when it's working and it's just right, not too much, not too little, it works beautifully. But when it's too much and over a long period of time, you can end up with a myriad of problems. People think about it a lot in terms of arthritis, but that's only one portion. You can have this in your cardiac system. You can have this in your neuropathies. So the point is, we want to get on top of chronic inflammation. For example, I had a patient who came in. They came in to see me last week, and I guess it was apropos because the weekend they were out having a barbecue or picnic or something. They were bitten by a tick. All right. They come in on Tuesday and they say, "Oh, look, I've been treated for the tick. You see the bullseye, Dr. Molly?" I said, "Yeah." Well, okay, but I'm not having any problem. You know how you always talk about Lyme disease on the radio? I said, "Well, it's really too early to tell about that." He goes, "Well, why would I want to come in for hydration therapy if I'm not having a problem?" I said, "How about coming in for hydration therapy to actually bypass having a problem?" And he said, "Oh, I didn't think about that."
So it's something that you may not know you have, right?
Well,
is that possible?
Yeah, it's possible. But generally what happens is you simply have some right under the waterline symptoms, just under. So you may be not feeling quite right. You're not having quite the digestion you had. You're feeling some aches and pains. But, you just can't attribute it to anything. And you may not have tested positive for any type of conventional testing, but you're not feeling well. I would say let's look at the inflammatory process, right?
It sounds like a sneaky problem.
Exactly.
Isn't it?
Exactly.
I mean, that's what I'm getting from what you're telling us.
It really is complicated is what it is, John, because when we have this chronic inflammation, you may not know you have it until you actually develop a condition.
All right, we're going to go to the phones. We have Ron, who is in South Jersey. Ron, good morning. You're on Health Watch, and you're on with Dr. Molly.
Hey, Ron.
Good morning, Dr. Molly. Yeah, I got a question for, I got two grandkids. They have severe allergies, and I was wondering if you could work with that at all.
Sure. How old are they, my friend?
9, 15, 16, and 17.
Well, 15, 16, and 17, I certainly can work with the hydration. Probably, and of course, we would check with Dr. Mark and Dr. Pat, but we've done that before, in particular during this last COVID outbreak, of course. Now, the 9-year-old, I definitely have some homeopathics as well as some physiological re-regulating low-dose medicines, as they put it. It's actually a homeopathic from Italy that can really help with that. So these kids all have allergies, and do they have skin conditions as well? Is that what you were saying, Ron?
Oh, no, not skin conditions.
Just the coughing, the wheezing, that kind of thing?
Yeah, the runny nose, drippy nose, and stuff like that.
Yeah, certainly. And it would be interesting to what's their pediatrician saying?
Well, I think they should go to an allergist, I'm thinking.
Yeah,
because,
well, I agree with that. But I'm wondering why the pediatrician hasn't recommended that. That's all. But I think Grandpop, you're right. Get them there. So, and I think we can certainly help with some natural products as well. Okay?
Okay. Yeah.
God bless.
Because, okay. All right. Thank you.
All right, Ron, thanks for the call. And
That's a nice call.
Feel free to call Dr. Molly in the office.
Yeah, I can get into a
further.
thing. It's an interesting thing because, you can go to the allergist, and many times they'll give you a medication or whatever. And allergies are a good thing to talk about inflammation or chronic inflammation. That's what's happening. And when that happens, it really can be a complex kind of situation because there's a lot of chemicals that the body itself, the white cells, put out in order to to really correct the problem. And then it's sort of a reverse mechanism. What happens is these chemicals trigger other responses then that make this condition worse. So it sounds, and it's a little complex for kids because we also have hormones in there that are growth hormones, and it's interesting. So that's an interesting case, and I think he's right to take him to an allergist, but I would go one step further and look at what kind of natural kinds of antihistamine. See, histamine is a big problem because if you have an overabundance of histamine, you're in trouble. You're in an inflammation process.
All right, back to what we were talking about, which was the chronic inflammation, and you mentioned the tick bite. What other issues can lead to chronic inflammation? Is it just the bite, or is it other kinds of things?
Toxins can lead, that kind of thing. In other words, for example, I have a patient that has a chronic mucus draining, and I'm beside myself as to what was causing it. But he was exposed as a younger man to asbestos. Well, you can be sure that that kind of environmental toxins can continue a low-grade chronic inflammation throughout his life. And if you don't think that has an effect on your fatigue, on your brain fog, this kind of thing, and then let's add some other conditions to that. For example, let's say you were exposed to COVID, and you already have a situation with chronic inflammation. I have another patient who, everybody knows my patient, Tim. Tim, unfortunately, worked also in a toxic chemical environment prior to getting the COVID. Well, do you think that's a double whammy of an inflammatory process?
Yeah.
You bet. So he's still in the long hauler program that we have at our facility. But the point is, he had inflammation prior to the COVID, and there's a good example of viruses that can trigger a inflammatory response. So, in other words, the idea is you want to make sure that your body is in optimal condition so that when you have an inflammatory response, it's the good inflammatory response, and the body knows when to cut it off, and you can go back to living a good life.
That's the bottom line.
It really is.
We are at the halfway point of our show. It's Health Watch, Sundays 8 till 9. Talk Radio 1210, WPH.D. Dr. Molly Fantasia, of course, is here. She is the Ph.D. doctor and the executive director and founder of Innovative Medical Associates, Marlton, New Jersey. 855-839-1210 is our number here. We always tell you this, and we told you before, 855-839-1210. Call early so we make sure we get your call in, and Dr. Molly can take some time to discuss your situation. 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We both come back. More Health Watch after these words. Oh, we're back. Oh, how about that? Threw us a little curveball there. Good to have you back. Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT. Operators standing by right now at Innovative Medical Associates in Marlton, New Jersey. And, of course, if you want to talk to them, we often talk here about Dr. Molly with the initial consultation. It is important, and that's really where you get a lot of your issues, your questions, kind of give you a direction as to how you can move forward and help out your particular challenge. All you got to do is call the operators right now and set that up, 856-489-0505, 856-489-0505. That's the number you can call right now. You can call well after we leave you at 9 o'clock this morning. They'll be there. You can call during the day. Listen, they don't go home, okay? 856-489-0505. And the website, innovativemedicalassociates.com. That is the website, innovativemedicalassociates.com. And again, our show is Health Watch, Sundays 8 till 9, the live version here on Talk Radio 1210, WPHT. 855-839-1210, our number right now here in the studio. If you have a question for Dr. Molly or a medical challenge, 855-839-1210. You have often said on this show, Dr. Molly, and you've said it in your office, I've heard you say it, we are not a spa.
No, we're not. And
So,
we truly
explain that.
Well, sure, because we're trying to use hydration therapy as a vehicle to actually help a patient with a particular condition improve their quality of life. It's not like a one-time deal. You can come into us with a headache. We can certainly get rid of the headache. But, what we're looking to do is put the body back into balance, okay? And IV therapy is a quick way of restoring the body balance. Now, that's very different than conventional medicine and what they use the IV therapies for. This was a very interesting article I saw. It was in a journal just this past month. And they talked about the use of IV therapies in the ER and IV therapies in the hospitals and in an outpatient setting, at a home setting. And when they were talking about this, they were talking about the use of IV for giving patients who were in pretty rough shape some nutrition. They were using it also to deliver pharmaceuticals, mostly, in particular antibiotics. But they went on to say that the primary use for the antibiotics in the home is end-of-life support. Well, I'm going to tell you, we're as far away from that as can be, because what we want to do is utilize the hydration therapies for individuals while they still have many years of productive life ahead of them and good quality life. So when I saw this, I freaked out, and I thought, wow. So when people come into me and say, why aren't the conventional physicians using it? I got the idea now why, and why my physicians are ahead of the time. This is an appropriate medical and healthcare modality. And that brings me to my good old buddy, vitamin C.
Yes.
The data out there tells us, okay, particularly when we're talking about chronic inflammation, vitamin C functions differently when administered in small doses, and that's usually less than 10 grams, than when it's administered in large doses. Now, when conventional people look at large doses, they're looking at doses of 25 milligrams or more. That's a small dose as far as Dr. Molly's concerned. Vitamin C is an antioxidant, which helps with the reduction of inflammation and boosts our immune system. But when given in large quantities, meaning the dosing, right, an appropriate dosing, it is considered an oxidative treatment, and it can effectively increase the cell's ability to make energy, clear waste products from the body, eliminate viruses and bacteria. It also has evidence of vitamin C weakening certain cancer cells, I'm not saying curing, which can actually confuse the vitamin C with glucose. And that's why there is some working. It works. We have a caller. Okay.
We'll pick that up in just a moment. We have Michelle in Center City. Michelle, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hey, Michelle.
Hi, how are you?
Good. How are you?
Good. I just have a question. It's a little off topic, but I was wondering if you know. With all the vitamin C and all of the other things that you take, like the chemo for cancer, like an ovarian cancer, when those cancer dead cells are in your system, how do they come out? Do they come out through, would they be flushed through with the vitamin C through diarrhea or something, or is it a different? How do they come out of the body?
Well, let's talk about that. That's actually what I was talking about. The evidence of high-dose vitamin C therapy weakening the cancer cells because the vitamin C confuses them, the C, with glucose. Cancer cells do not share the normal cell's ability to process C and become impaired in the process, mistakenly thinking that it's a glucose molecule. So what happens, it can help with the traditional chemotherapy and you excrete it out through your kidneys. That's why in a clinic, in a medical hydration clinic like ours, we look at several things even before on the first treatment. We're looking at kidney function, so we make sure that the kidneys are optimized, and if they're not, we actually put a patient on a particular probiotic specifically to enhance their kidney function. And the other thing we look at is a particular enzyme on how it breaks down the vitamin C so that we can support the use of the vitamin C by excreting it out through the kidneys. Does that help answer the question?
Yes, ma'am. Thank you very much.
God bless you. Hey, Michelle, I hope you're not calling for yourself. I mean that. If you are, I wish you a lot of good luck.
All right, Michelle, thanks a lot for
Thank
the
you.
call. Appreciate it.
That was a nice call.
855-839-1210. That's our number here in the studio. Back to, we were talking about hydration used in conventional medicine. I had cataract surgery a couple weeks ago, and they hooked up an IV.
Of course they did. They have to keep that line open. They had to give you, that's why I love Dr. Pat. You know, she was an anesthesiologist, right?
Right.
You keep that line open in case there is an emergency while you're having the cataract surgery.
Yes.
Right? They give you a little twilight, you're feeling a little groggy, you're out of the picture, and then you're done. That is a conventional use. But interesting, this article made the point to say that it's being used more and more for end of life. Well, I don't want that, okay? What we're using it for is to improve your quality of life, not to look at ending it, okay? The other thing I want to talk about is, you know, we use IV glutathione, and you know that there is a push right now to sort of limit our ability to get glutathione. And I want people to look at AHA, Alliance for Natural Health. Look at that website. Go on it. It is a not-for-profit company. Look at this, please. It is a organization that a lot of integrative physicians belong to, and integrative pharmacists, people in the healthcare business. Please look at that, because what we want to do is be able to access glutathione because it plays a key role in cells of the body and the brain. And all chronic inflammation and chronic illnesses drain the glutathione reserve. That's why it creates more vulnerability to additional conditions. So restoring glutathione is vital in reducing chronic conditions that burden the body. And vitamin IV with glutathione is a popular solution.
How many times, you were talking about end of life, I mean, how many times have you had patients? We mentioned this earlier in the show. You've had patients, and they say, well, you know, my oncologist said I might have 6 months to a year. And, you know, 7, 8, 9 years later, they're still around. Well, and they're in your chair once or twice a week. Yeah. And you've helped them. So that's how you use it.
Look, we use it in a way to improve the body's overall quality of life. And that, you know, it is a complex, you can, just from what I said to Michelle, it's a complex thing, vitamin C and what it does, the role of it. But you've got to understand there are other nutraceuticals that work to help reduce chronic inflammation. So alpha lipoic acid is one. It helps the cells recirculate the vitamin C and E as well as the glutathione. So these are the things, when you're getting an IV in our facility, you're getting an IV that is tailor-made for you, and it's working on these various complex biochemical systems. And we really need to do this because, for example, I had a patient, Vernon, that I was talking about, I think, with you before the show or maybe during the show. And he was a nurse, a registered nurse. He had very bad nerve damage in his feet. He felt like his feet were on pins and needles. Well, the use of alpha lipoic acid actually helped stimulate nerve repair, reduced his blood sugars, which helped, and it reduced the pain and inflammation he was having on an ongoing basis. But again, it was how we use the ALA along with what other kinds of nutraceuticals. I happily tell people you can't patent your nutraceuticals. They're God-given.
That's right.
They're God-given. However, the use of them, how we use them, and how we use them together, and in what kind of relationship, the synergies of these particular nutraceuticals to each other is very important. And that's what we do differently at our facility.
We are coming up on our final break of the morning, which means you still have time to jump in here with a question for Dr. Molly. 855-839-1210 is the number here, 855-839-1210. It's Health Watch, Sundays, 8 till 9, the live version here on Talk Radio 1210 WPHT. Again, 855-839-1210, our number. With Dr. Molly Fantasia, I'm John DeMasi. We both return. More Health Watch after these words. Hi, it's John DeMasi, host of Health Watch, Sunday mornings at 8 and again at 4 here on Talk Radio 1210. Have you or someone you know been diagnosed with cancer or breast cancer? Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates can help. They offer medical hydration therapy. Their cancer support program is designed to reduce chronic symptoms often associated with diagnosis or treatment, including pain and fatigue. Dr. Molly's unique protocols have improved quality of life for hundreds of patients.
I want to help you heal. I want to help you have a quality of life while going through cancer treatments.
Visit innovativemedicalassociates.com to learn more about their cancer support treatments. Join me and Dr. Molly when we discuss the benefits of medical hydration and more on Health Watch every Sunday morning 8 till 9 and Sunday afternoon 4 till 5 here on Talk Radio 1210. This is the point of the show where we remind you that operators are standing by right now at Innovative Medical Associates at 856-489-0505. Now, just because we leave you at 9 doesn't mean they go home, because they stay there. So you can feel free to call after 9 o'clock. 856-489-0505 is the number. 856-489-0505. And don't forget the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Check out the part of Dr. Molly's own line of skincare products, especially with the sun and especially with you needing sunblock and sun protection. She has a line for that. So there's a lot of things on there, but check that out. innovativemedicalassociates.com is the website. And don't forget, if you missed any of today's show, we have our Health Watch replay this afternoon and every Sunday afternoon, 4 till 5, here on Talk Radio 1210 WPHT. A couple of minutes left of the show. If you have a question or a medical challenge you want to run by Dr. Molly, 855-839-1210 is our number here in the studio, 855-839-1210. I wanted to talk to you about your physical therapist, Dr. Carol.
Oh, yeah,
who
she's
has
great,
been doing a great job. And the last couple of weeks, she had some medical challenges.
She had COVID.
Right. Yeah. And other issues.
And other issues, yeah.
And what she's been telling me the last couple of weeks, she says, when I come in, she says, I feel kind of sluggish, and then I get my IV, and I feel so much better.
Yes.
And she usually gets the IV before she gives me my treatment.
Right on. Actually, she does it before she has scheduled patients. Yes.
Exactly. So, and I'm one of the scheduled patients.
Right.
So I just wanted to mention, she tells me, and I didn't solicit this, she said, she can see and feel a big difference after the hydration.
Right. Well, one of the things that's interesting is not only is she post-COVID, she actually tested, she has certain other viruses. And Carol has a very busy practice. Her practice is very busy, not just in my place, but also she has an office in North Jersey. And she treats children. And so she then is exposed to a lot of children's problems, right? Because they don't wash their hands. They don't, everything that, we're taught to do, they are not doing,
right.
Kids. But what's happened is, it was an interesting thing, because I started talking to her and I said, you have a chronic type of inflammation that we ought to try to get to the root of. Is it an exposure? Is it some other kind of problem? Did you have an injury? Tell me about this. Well, anyway, it turned out that she told me she had herpes simplex, which is the herpes that you get, we're familiar with, that can give you cold sores, that kind of thing. Well, I ran a herpes simplex, panel. And in it has other, HS1 and 2 is the one we normally look at, because that's the one that most often comes up. But in her case, she has an HS6. She doesn't mind us talking about this. It's usually a herpes that affects kids. So she caught this from her kids. Right. So we laugh about it, but it's interesting that the adult body, and in as good shape as she's in, remember, she's a physical therapist, so she works herself out, okay? And as good shape as she's in, the nutritional IV that we put together for her has really helped her come back to balance. And it's still not where she should be. I mean, it's a long haul. These viruses can knock us right on our keisters, and we really got to realize that there are a ton of them that we don't even know about yet. I'm telling you, that contribute to fibromyalgia, chronic fatigue, and all kinds of other immune problems that really result from chronic inflammation.
And you're right. She did tell me she's still not where she used to be, but the hydration is helping her.
Right.
It's helping her to get there.
It's getting there.
All right. 855-839-1210 is our number here. You had a question in a consult, and I thought this was very interesting. Can the IV hydration therapies help you sleep?
The short answer is yes. Okay, the short answer is yes. And there's a reason for that. Many times you're nutritionally depleted in the types of nutraceuticals that aid the body in sleeping. And you have to understand, sleep is pretty complex, right? Pretty complex. So one of the things we definitely use is magnesium. So magnesium is what? A mineral. It's an essential mineral. And if you don't get enough magnesium from your diet, which most of us do not, by the way, John, get enough, right? It can help you improve regulating the body's stress levels and response system, which then actually helps people fall asleep more quickly. Also, selenium. Selenium is another mineral. It's a trace mineral. It has a lot of health benefits. It's really helpful in cognitive decline, cardiovascular disease, and actually it's used in some thyroid conditions. But what we think selenium does is it lowers the likelihood of difficulty falling asleep, and there was a study in 2020 and 21 that showed that that's exactly how it works. The other thing is a favorite of mine, taurine. Taurine is a particular common ingredient in sports medicine energy drinks, taurine, because why? It helps stabilize and stimulate the muscles. But it also has sleep benefits, which it assists in producing melatonin, which is the hormone the body needs to sleep. And by the way, we can also deliver melatonin.
All right, I wanted you to mention this. We have about a minute left of the show. You were telling me about a patient, and I met this patient.
Great guy.
He had a torn ACL. And
Yes.
he's completely cured.
No, let's not say cured.
Okay.
What he is his ACL is completely healed.
Okay.
And that's from some regenerative type of medicine that we use at our facility, utilizing IV kinds of therapies. And I urge people who have an interest in that to call me at the office.
Normally, so he avoided surgery.
Oh,
obviously.
Definitely he did. And right now, how do we prove this? He had the MRI before, and he's had it now, and the MRI shows nothing but some swelling of the soft tissues, which you want, because what is that? That's healing. The swelling is healing. That's what the body should be doing. It's the proper inflammation happening.
Another success story, and a perfect way to wrap up the show. That is going to put the wraps on another edition of Health Watch. Don't forget, you want to talk to Dr. Molly, you want to set up the initial consultation. Operators standing by right now. They'll be there after we leave you at 9, 856-489-0505, 856-489-0505. Check out the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And don't forget our Health Watch replay, 4 till 5 this afternoon. If you missed any of today's show this afternoon, you can hear it all again, 4 until 5, here on Talk Radio 1210. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses Jess and Lana, and our medical assistant, Karen Kathy. I'm your host, John DeMasi. Thank you for listening. Have a great week and a healthy one. We'll do it all over again next Sunday, the live version, Health Watch, 8 till 9. You're on Talk Radio 1210, WPH.D. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.